A young child shows up to the medical office with a basic upper respiratory illness. Stuffy nose, sore throat, mild fever. 5 days later, they're paralyzed. This is happening across the United States, and I want to talk about it on this week's Wednesday Checkup. A 5-year-old girl and her parents come to a family medicine doctor's office for a typical run-of-the-mill upper respiratory infection. In fact, the only reason the parents are bringing the child in is because they wonder, should she get antibiotics or not? In taking the child's history, we find out that the young girl has had a sore throat, a dry, non-productive cough, and some runny nose for about a day or two. There's been no fever that's been recorded, but the child has felt warm and sweaty at certain times, maybe slightly decreased appetite, decreased activity level, but overall the child is still playful, feeling well, maybe a little bit fatigued. On physical exam, the child has a high temperature, but not a fever, because we classify a fever as 100.3 or higher, and the child has a temperature of about 99.9, which isn't normal, but not yet a fever. The ears look totally normal, not red, not infected. The throat, mildly red, no white spots, no signs of outward bacterial infection. The sinuses are non-tender. There is some runny nose, but it's clear. It's not green or overly mucousy. The child's lungs are clear. There's no pneumonia. The stomach is soft. It's non-tender. The reflexes are all totally normal. And what the doctor figures out from the situation is that the child is suffering from an upper respiratory infection because of a virus. Knowing that this condition is caused by a virus and not a bacteria, the doctor recommended a few things. First and foremost, no antibiotics because they don't work on viruses. He recommended rest, hydration, nasal saline to rinse out the sinuses, over-the-counter medications to keep the child comfortable, and the magic bullet, green tea and honey, to control that nighttime cough. The parents were very happy with this plan. They rated the doctor 5 out of 5 stars, and they went home and the child started to get better each day. However, on day 6, the child suddenly developed arm and leg weakness, very significant arm and leg weakness, so much so that they called the doctor's answering service. The on-call doctor calls back. Here's the whole history. The child had a mild respiratory virus, 5 days later developed this arm and leg weakness, and immediately told the mother, "Ma'am, you need to bring your child to the emergency room right now because I'm afraid your child may have acute flaccid myelitis." The condition the doctor is referring to, AFM, has received a lot of publicity over the last year because it's a frightening proposition for anyone that has young children at home, and I totally understand that. Look, this is a rare illness, it's a mysterious illness, but there are things that we do know, and I'd like to discuss them here today. What is AFM? This is a neurological polio-like disorder affecting the nerves of the spine that causes muscle weakness, decreased muscle tone, and at times even paralysis. It most commonly affects children around the age of 5. What's scary about this is if the paralysis affects the respiratory muscles, the child can stop breathing. Because of this, the CDC states that 98% of patients who have this condition end up hospitalized, with more than half ending up in intensive care units. The scariest part of all of this is that both the CDC and doctors don't yet know what causes AFM. We do have a strong suspicion that it's related to these mild respiratory viruses that come a week prior to the child developing AFM. We've also noticed that in areas of the country where these respiratory viruses are spiking, we also see higher rates of AFM. The prime suspect at this moment is enterovirus D68. Normally, when children are infected with enterovirus D68, they have some mild respiratory viral symptoms, or they can be asymptomatic altogether. And most don't develop AFM, but some do, and we don't know the reason as to why. You might be wondering, what's the prognosis of this type of condition? To be honest, they're not that great. About 70 to 80% of children who are diagnosed with AFM months later will still have some level of residual weakness despite our best efforts at treatment. But why now? Is this like a newly discovered condition or something? No, AFM has been around sporadically, but in 2014, the CDC have noted a global epidemic of it with the spike in cases here in the US. We have noticed a pattern to this disorder where it spikes between August and October, which is really interesting because August is starting right now, and it spikes every other year. So in 2014, there was a spike in cases, then in 2015, it kind of leveled off, 2016 spike, 2017, it kind of leveled off. In 2018, last year, it was the biggest ever spike and the most cases ever recorded with about 230 cases, bringing up the total today to to just around 600. So what do we do if a child is brought into the hospital and diagnosed with AFM? This is where things get tricky. Because we don't quite yet know the cause, it's difficult for us to recommend a foolproof treatment. If you visit the CDC website as a medical professional to get advice on what you should do with a child who has AFM, there's no good evidence. There's things that we do for these children because they work in other neurological conditions like steroids, immunotherapy, plasmapheresis, all these medical treatments, but none of them have great evidence. The only thing that seems to work very well is early intervention for occupational and physical therapy. What we're actually doing is having the child retrain their nerves and muscles so that they can function effectively once again. I mentioned earlier that even though this is supposed to be an off year for AFM and we're not supposed to see a peak, we still should be on the lookout for certain symptoms. And that's because the earlier we can get a child to the hospital with AFM, not only does the child fare better, but we can get better samples that we can then send to the CDC for future research. Symptoms you should be on the lookout for when it comes to AFM is difficulty moving the eyes or drooping eyelids, facial droop or weakness, difficulty with swallowing or slurred speech, or sudden arm or leg weakness. When doctors obtain samples from their patients, they automatically request consent from these patients to send them to the CDC for future research. Actually, the NIH just gave the University of Alabama, Birmingham, a $10 million grant to study the natural history and progression of AFM. So how do we protect ourselves and children from AFM? Well, first you have to understand that while we suspect that there's a viral component, this isn't a contagious illness in the sense that if a child has AFM and your child interacts with them, that means they're gonna get it. That's not how this works. This is a sequelae or a complication of the virus. So just by following some simple steps, you can protect yourself from viruses, which then will protect you from the complications of these viruses, such as AFM. Those steps being practicing good hand hygiene, always washing your hands, avoiding touching your face, washing and disinfecting commonly used surfaces, practicing good cough and sneeze hygiene, dab. If you're sick or your child is sick, please stay home. And most importantly, vaccinate yourselves and your children. Because when you get vaccinations, you protect yourselves from the viruses that can cause complications and kill. In fact, the reason why we give the measles vaccine, for example, is not necessarily to protect you from measles. It's to protect you from the complications of measles. Actually, there's an interesting fact to be had here. Polio had complications that were very similar to this, where children were becoming paralyzed, not being able to move their arms and legs. And guess what? Polio was eradicated because of vaccinations. If you have any outstanding questions about AFM, I'm gonna drop some reading links down below in the description, and please feel free to jump into the comment section. You know I'm quite active there. And don't forget, tomorrow night, Chasing the Cure Live is premiering on TNT and TBS, or you could stream it online, 9 p.m. Eastern Standard Time, 6 p.m. Pacific, August 8th. See you there, because I'm gonna be watching it also. As always, stay happy and healthy.